Hi, and welcome to the Behavioral Business Blueprint, where we dive into the world of behavioral health entrepreneurship. This episode is a little different. Our special guest today, he's not an entrepreneur, but every entrepreneur in the behavioral health business space has probably read his work. This person is a reporter with my personally favorite behavioral health business website, which is called the Behavioral Health Business. Today we have Chris Larson. How are you doing, Chris?
Hey, Arthur, I'm doing great. How are you?
I'm doing good. I've been wanting to do this for a while. I'm pretty excited. I read all of your articles, I can say.
I appreciate that.
And even though I say, hey, I know normally we talk to entrepreneurs, and I'm sure you might have some other entrepreneurial things going on outside of this, but what is your sleep schedule like? Because you push out a lot of articles, and I'm sure you have to research and talk to people to put these together. So, I mean, when do you find time to sleep?
Yeah, I don't. I've also got two. It's not because of my work, it's because I have two kids. Luckily, they're getting a little bit older, so I'm able to get into a more regular sleep schedule. Just turned 8 and 5, so they're really fantastic ages, but I lose sleep over them and with them pretty frequently. They're both in public school, which is the literal, lab for all kinds of communicable, diseases, tummy aches, headaches, colds, and things like that. So I'm losing sleep, but not because of my work. Luckily, I have a really awesome support structure around me. My editor, Laura Levitt, is awesome. And we also have another reporter who works at BHB, Warren Gonzalez. So between the three of us, plus some really great leadership at our parent company, we're able to be very effective planning out our time, identifying opportunities to engage with what's going on in the industry. And a lot of what we do focuses on the people part of the industry. So because we're focused specifically on the business of behavioral health, we're able to really fine tune what audience we're writing for. That's very, very narrow, very, very specific. There's a cliche out there, the riches are in niches. And
Yes.
that's where we want to play. It's a very small space, very specific space, but it's one that, as we've been able to find and prove out, there is a huge need for information and analysis about the world that behavioral health professionals are working in.
Yeah. And how did you get into this? And specifically, you write about autism because I'm on the site and I see you have other parts of behavioral health like substance use. I think it's disorders now, and some other things. But how did you get specifically into writing about autism, or even into just writing for them?
Yeah, starting with how I came into the job, I was actually recruited to the role. So I had a very passing familiarity with our parent organization, Aging Media Network. And as that name suggests, they cover the aging media industry, or the aging industry. Specifically, they write about the post-acute segment that's kind of targeted and pointed towards taking care of American elders. So while I had a passing familiarity with them, I really didn't know what that part of the healthcare economy was all about. And I knew even less about the behavioral health industry. And it wasn't until that I got an email from the now former CEO over at Aging Media Network asking me to apply for a role that I was able to have, as another saying, I'm sure you're familiar, if I had the scales removed from my eyes and realized that there was this whole other world within healthcare that is simultaneously needed to the max, but underappreciated in extreme degree, that unless you really have a direct experience yourself or vicariously through the experience of a dear loved one, you're probably not terribly familiar with the behavioral health industry. So to answer your other question about how I got to writing a little bit more about the autism space, that was something I also really didn't know was a specific industry until I started working here. So a lot of my work so far has me, again, borrowing another cliche, kind of falling into it. So at the point I've kind of fallen down almost a flight of stairs to kind of stumble in and wobble into this role. The long and the short of how the autism industry really came onto my radar was a lot of the ups and downs that were going down in the early summer of 2022. Very first thing I kind of dug into was the substance use disorder industry. That was one where my predecessors had really plowed plowed a lot of earth, sowed a lot of seeds that could kind of come through and reap with a lot of the coverage that they had done and borrow the momentum that they had. But when things with cards specifically, a lot of the closures that they announced in 2022, 360 Behavioral Health announced some big layoffs, and everything kind of happened all at the same time in the early summer of 2022. You got to remember at that time, inflation was taking off. It had taken off, during the earliest phases of the pandemic, but we were really concerned about A, not getting sick, and B, trying to live life under a new virtual paradigm. So we weren't really too worried about inflation initially, but as we got solidly back into reopen mode, all of a sudden everything was costing a lot more. All of a sudden there was this scramble for talent because people were leaving the workforce because they had other stuff going on. It realigned people's priorities. Families were discombobulated. All of a sudden you don't have a steady, ready workforce that's lining up, eager to work for relatively depressed wages, and all of a sudden there's a run on talent, and you have this perfect storm in 2022, which it hasn't really abated. It's kind of split up into smaller, more less virulent storms in the autism industry. But that's really how I got into it, and through that work, I was able to carry that momentum forward and really get, I guess, out there or known or noticed by professionals in the autism industry. And then from there, it's been an accelerating pace of work as I've continued to learn more about the industry, meet more people, and develop a network of not
Are
quite.
people
Yeah.
reaching out to you to give you these stories, or are you just on the internet searching? Like, how are you able to pick and choose what information that you want to put out there? Because again, you put out a lot of content that it's a lot of information that people need to know, especially if you want to be in this business, to understand the different people out there that are fundraising or who's expanding or acquiring a new company.
So the answer to that question is yes. So
Okay.
the thing that makes my role, very, very different, the way that I'm able to do, or the reason that I'm able to do what I do, is because I don't have a job in the same way that your readers would have. Like, I'm not a behavioral health professional. I'm not simultaneously, like a clinical director at a clinic. I'm full-time, totally dedicated to reporting on, covering, examining, understanding the behavioral health industry. So with that total dedication, I'm able to do a lot of things that professionals out there they just can't do, because they got better things to do with their time. They got to take care of people. I just, I slap a keyboard on a laptop and words come out. So
Some good
I was trying
words.
to remember my place in the industry relative to it. So to get to not be so glib, but actually address the meat of your question, I am doing everything that I can to try to find information constantly. I'm like chronically on LinkedIn. So I'm looking at, people's job changes. I'm looking at what people are saying online. Are they talking about being laid off? Are they talking about this great opportunity to help an expansion of like 10 new whatever clinics in whatever part of the United States? Companies do send me information that they do want me to cover, and I get that a lot. But there's this certain, not quite sure if enigma is the right word, where a lot of the times that people who are telling me information that they want out there is not necessarily the information that I want to know, because there's a lot of self-promotion and people looking for free stuff. They just want people to do their advertising for them. So while I do get a ton of information, only some of it is really useful to our readership. And I don't know like what the specific balance is. I'm gonna maybe it actually is pretty equal. I maybe do like 33% getting information just into my inbox that I think is relevant or might be relevant. The other third is me networking, which I do as much as time allows, online, in-person events. And then the other third is just trying to be hyper aware of the online discourse.
So with everything that you're reading and seeing, where do you see this trend of behavioral health business in the next 5 years?
It's hard to say because it looks a little different for specific, segments of the behavioral health industry. Is there one that you're
So
Notably
I will say
interested. Okay.
for autism, because that seems to be the one that's just constantly shifting. I don't even want to say that, the industry's finding its identity, but it's just evolving. It's still kind of in its infant stages compared to
Mhm.
substance use disorder or
Mhm.
even like memory care.
Yeah, in terms of maturities of industries, I would agree with the assessment that the autism industry is the one that is the least mature, least developed. The kind of run down quickly just some of the other parts of the behavioral health industry, like the psychiatric hospital system. It's grown up kind of as the awkward little brother of the rest of the hospital system, but it has had at least the kind of cast off support that the rest of the American hospital system has had. So I'd put that at the most developed end in terms of industries. And then just below that, definitely going to put substance use disorder treatment, because that's been, frankly, it's a tale as old as time. Humans have constantly been looking for intoxicating substances to put into their bodies to help them feel good for
Mm-hmm.
any number of different reasons, different substances, different contexts, different cultures. But at the end of the day, it's humans wanting to feel good, feel something that the substance does to them. And because of that, there's been a ton of attention paid to it. And then the opioid epidemic, of course, of the late 90s, early 2000s has only pushed that into the forefront of American culture in a huge way. But, you look down the way and look at the other segments of the behavioral health industry, and autism has not had a comparable impetus accelerator to take it from the mom and pop institutions or the obscure corners of academic medical centers into the forefront up until very, very recently. So the way that I would characterize it is that we haven't even found the identity yet of the behavior of this particular part of the behavioral health industry. We recognize that there is huge need. We recognize that the constraints on it are also simultaneously huge. And people who are doing this work are caught in the middle, being pulled in multiple different directions. And no one really knows what this thing is going to be or what it's going to look like at the end of the day. So I'm right here on the ride with all of you guys, just watching it. So I don't know where it's going to go.
Well, we know that you'll be the one that's writing about the constant change, so you'll be able to look back 2, 3 years from now and just say, oh, okay, this is what I said or I wrote about, and look where we are now. I'm constantly paying attention to behavioral business, especially autism, but especially even the substance use disorder. That's a newer one that I'm looking to just because of my current work, just trying to see what's going on. I had no idea how big that industry was. Of course, I'm just on the website and I'm learning, and I said, wow, this is. I wish I'd known about this earlier, maybe a couple years ago. I might have gone that route, but I'm always curious to learn. So I know you all, the behavioral health business, you all have conferences each year, and I'm hoping to make it to. There's one in October in Dallas. I'm
Mm-hmm.
hoping to see you there in
Yeah, see you there.
person. Okay, I saw you went to the one in Miami. It was the Value Conference,
That's right.
and I guess I'll ask you this because you report on it. What did you learn about value-based care? Anything in particular that stood out? Because I'm still learning and I'm still on edge of, is this going to be something that sticks for autism especially? This is a little bit different compared to other industries.
Yeah, value-based care, like as the concept existing in medical academia, as opposed to how it exists, out in the real world, is very, very different. In academia, you have your triple aim, your quadruple aim, quintuple aim, whatever, um, on what value-based care is supposed to be. But in reality, people are just using the phrase to describe anything that's not underfunded, highly burdensome fee-for-service paradigms. So it's kind of a catch-all phrase. So kind of understanding that at the outset is really important. So people will call even a fee-for-service schedule with some incentives based on either care outcomes or procedural measures like time to care, things like that. And we can call that value-based care because it is at least aligning the business incentives of both the payer and the provider to do something that creates more value for the patient and therefore the wider system. So that's a really good key understanding when you're part of this conversation. The other part of it is that a lot of I wouldn't say a lot, but also not a large enough portion of the wider provider industry is looking forward to this. So there's a small-ish core of very eager providers that recognize that doing the kind of work that supports a value-based paradigm, measuring outcomes in terms of both care and procedure, really focusing a lot on clinical quality, making big investments on training, certifications, things like that within their provider group, being up on electronic health records, and even just the very basic digital systems to help run a business are big investments that are being made. And while this all sounds like very, very fun, very fancy, very techie stuff, behavioral health has been so behind on this that we're doing things that were done in the rest of healthcare 10, 15 years ago, and then the rest of the business industry 25 years ago. So people who are there's people still walking around with paper and clipboards doing this kind of work. And I mean, when you think about paper and clipboards, I'm thinking about an 80s PE teacher with a whistle around their neck, right? Like that's not an unusual setup for us in the year 2024. So to distill that down, there's a not insubstantial, but small portion of providers that are making substantial investments for a new paradigm. But the biggest, most overarching takeaway from that conference is that the power to do this resides with the payers. There's a reason why in the wider discourse around American government that we believe that there is power associated with money, right? Congress has the power of the purse strings that is supposed to make them, the kind of the superior branch of government. Even breaking down that concept into something more real and specific, usually the person that has the power of the budget in a household is usually the person who's helping to drive a lot of the decisions. Mm-hmm. So applying these two, the same kind of ephemeral principle to the behavioral health industry, until there's wide acceptance, adoption, and frankly, just an agenda that's put out by any one of the big 5 health insurance plans, you're not going to see a ton of progress. And a lot of the reasons why they say they don't know what to do is because they're getting all kinds of different proposals from different places. They like to lean on what I think aren't really great disputations with what actual good care looks like. Frankly, it seems like a bit of a cop-out. Even if you wanted to sidestep the science part of healthcare, just setting up systems that look at the business part of healthcare, the time that it takes to get people into care, how many sessions are they getting? What's the recidivism rate looking like in treatment? How long and how effectively are you able to retain people? These are all things that that are very easy, that don't actually grapple with the sticky, difficult problems of providing healthcare and paying for it, that could be done right now today. And there's a great irony in what a lot of Americans think about with insurance companies. You think that since they're so big, they make so much money, that they would have the latest and greatest of business systems. But you actually talk to these people and they don't. They actually don't invest a ton of money in business systems that would allow them the agility to engage with new value-based care systems.
That is very true. It's so backwards. I'm just laughing thinking about the PE teacher with the clipboard, because that's so true. I just think about when I was working in ABA, and a lot of times you're walking around with paper, pencil. You go to maybe some of the bigger companies, they've made the upgrades to, okay, you have a tablet, which costs money, and it comes back to reinsurance reimbursement, because that's where most families are using. You only have a few that can pay out of pocket and not blink an eye. But this was a good conversation. I definitely want to continue this one, especially in person. Hopefully I see you in October. What's the best way for people that want to reach out to you?
Yeah, you can reach out to me on LinkedIn. Although there's a bunch of Chris Larsons out there on LinkedIn, so maybe a little hard to find there. I'm the bald one with the suit. That still doesn't narrow it down terribly for LinkedIn. It's not like Instagram out there, folks. My people fit in a little bit better with this look on LinkedIn, not so much on Instagram. You can also email me at clarson, CLARSON, at WTWHmedia.com.
All right, y'all. Well, thank you for listening to another episode of the Behavioral Health Business Podcast. We'll see you again later.